Am I at risk for opioid use disorder? Will I develop addiction if my doctor prescribes me opioids? It's a question on many patients' minds when they receive that prescription. And the reality is the answer is most likely no. But the truth behind this whole conversation is that we'll never really know, because opioid disorder can affect anyone. Now, there are certain risk factors that place people at higher risk of developing OUD or addiction, and those risk factors will often be surveyed by your provider before you are administered or prescribed them. Problems such as having a background in addiction with either tobacco, alcohol, or other substances can certainly be a risk factor. A history of bipolar, mania, depression, anxiety, or other mental health disorders are also common. People who don't have normal lifestyle functioning can frequently develop the condition, and often they use it as what we call medical coping to help relieve the stress or anxiety with their circumstances. Younger age groups, age 18 to 45, have been recognized as being more likely. The reality is that when your doctor provides these to you in a safe manner, which is for the right condition, at the right dose, for the right length of treatment, odds are you won't develop these problems. But it's important to have these conversations. So ask your doctor the day you receive opioids whether or not you're a good candidate for them. What if we are the generation that ends this opioid epidemic for good? Opioid-related overdose deaths are now the #1 cause of death in adults under age 45. Their influence has been so great, they're even reducing the American life expectancy. These trends have us fearing the worst, and as a result, we begin to view opioids as the enemy. The drugs that we've long trusted to help kill pain are now killing us, and with this, we fear what they'll take from us when we take them. But what if opioids aren't the enemy? What if our misunderstandings of them was? What if we truly took the time to understand pain and addiction from the perspective of those dealing with it? Would our stories have happier endings? You see, the opioid epidemic is always personal. I lost my own nephew, just 24 years old, after sustaining a head injury in a skiing accident, unable to live with the pain anymore and unable to navigate the medical system, to suicide. You see, the opioid epidemic is a story about all of us. It's about the people we love, the people we've lost, and the people we fear losing. Medical providers can't prescribe us out of the opioid crisis. Government agencies can't regulate us out of it. Drug treatment programs can't counsel us out of it. It is time that we start to fight the myths about opioids instead of the drugs themselves. What would the world look like if we were equipped with the information on how to use opioids wisely, store them safely, avoid their risks, and reverse their problems? It's time we turn our attention away from the battle against opioids and instead put our focus on the people who may truly benefit from their use, or those who are facing their consequences. What if we all work together? Hope is in sight, and this crisis is ours to end. This can be the generation to do it. That ending must include you.